John and Ken Show. John Cobelt and Ken Shampoo. It's KFI AM 640.
All right, time to spend, a lot of time on Senate Bill 562.
We're giving you an early warning here.
This is a bill that's making its way through the legislature. It's still got some ways to go. It is the single-payer health care system for Californians. You know, this happened before, but it passed, but Schwarzenegger vetoed it. Did you know that?
I remember this. Last time they tried it was 2007.
Right.
So it's been 10 years. The cost of this is astronomical. It was a single-payer plan, so the government would pay all the health care bills. It would cover essential health care benefits, including mental health, maternity care, prescription drugs, vision and dental care.
Everything. Your private health insurance would be gone and be replaced by the state administering everything that goes on with your health care. You can only imagine. State Senator Jeff Stone wrote an editorial for the Press Enterprise. If this legislation were passed and signed into law, Californians would be on the hook to pay for a $200 billion program. Right now, the entire general fund is roughly $125 billion. This one bill will cost more than an entire current state budget. Think about that. How do they expect to pay for it? He says there might almost be a 10% tax on all incomes. That means most working people in the state will have a roughly 20% state income tax because that would go on top of
and then the wealthy would be paying.
Yeah, they got 13.3.
It would be a 23% income tax on top of the 40% federal tax.
Then he says it'd be a payroll tax of roughly 20% that'll have to be paid by employers in the state.
Oh, well, that is going to cost a lot of jobs, isn't it?
Now, they'd say, on the bright side, you no longer have to pay a health insurance bill.
No, but we've got to pay for all the poor people and the illegal immigrants. Pay anything.
That's right.
See, that's the thing.
This would be another sliding scale tax.
Are you in the union plan?
Well, yeah, I have to.
Okay, so
I guess I don't have to be, but I am.
No, I mean, you could do it with the company plan.
No, I'm in the union insurance.
All right, so we have to pay an insurance rate based on everyone else who's in our pool. But if you go to single payer, it's going to be everybody in the state in our pool.
And 12.3 million are on Medi-Cal?
Yeah.
Think about that? Like a third of the state? Or
So whatever you're paying or I'm paying in health care benefits, and I imagine this goes for anybody who's getting private health insurance through their employer or their union, you're going to pay a hell of a lot more because now you're responsible to cover all the poor people here and a huge chunk of the state.
Right. This one's clear. If you have any wherewithal and you take care of yourself and you have some type of insurance, John's right. All the poor people that have nothing and are, quote, getting substandard medical care, we're all going to be pooled in together. So we're all getting the same, mediocre health care?
Well, yeah.
But you'll no longer be able to have what you consider to be good health care.
No.
Because you'll be in the same system with everyone.
So
In fact, John will be lining up at the same clinic.
Yeah, that's what it's going to be. We're probably going to be standing in line at clinics. When Schwarzenegger vetoed this in 2007, they thought it was going to cost $210 billion. It's probably going to cost way more than that now.
Yeah, it's 10 years ago.
Yeah. I mean, there seems to be huge healthcare increases every year. So 10 years worth of health increases, this thing's going to be $300 billion.
And we didn't even get to the best part. It has to be run by the state of California.
Yeah.
I mean, the DMV is a classic example. Caltrans. How many agencies can you think of? Imagine them trying to administer this monster. And how many government workers would have to be hired? Pensions, pay. Holy mackerel. Imagine the unions there in Sacramento chomping at the bit to get all the pay raises for the people involved in the single-payer health care.
I'm headed for the streets. No justice, no peace.
No,
You can't take away my.
Right now, I'm leaving.
You can't take away.
I'm leaving California.
Yeah.
If this happens. I am.
I think that's what everybody ought to do.
I'm done.
You can't take away my health care.
You know, these people always tell us to boycott this and boycott this. I think they're right this time. I'm out.
This is
not going to happen. It'll be over my dead body, and of course, I'm dead. I don't need health care. So that kind of answers that.
This is so crazy. And it comes. I forgot who's sponsoring this thing. Is it that idiot Ricardo Lara?
It is Ricardo Lara.
Okay, he's the cow fart guy.
Well,
he's so stupid. That guy. He's so stupid.
No,
Every idea he has makes you bang your head against the wall. He wants to regulate cow farts. Now he wants to take away. Most people have health insurance and like it. Most people with private health insurance through their companies or their unions, they like it. I'm not responsible for all the poor people that they invited into the state, that the feds allowed into the state. I'm not paying for their health care. I don't want to. I don't have to. You can't make me.
Here is State Senator Toni Atkins of San Diego, one of two sponsors of the bill. She's the other idiot sponsoring it.
Oh, she's a crackpot,
She said,
too.
Our constituents shouldn't have to experience the anxiety of not knowing whether they'll be covered based on who's occupying the White House or what party's the majority in Capitol Hill.
Oh, God almighty.
Even if Obamacare survives, its benefits haven't reached everyone in California. We can do better at driving down health care costs for families and individuals.
Nobody's been able to do that. It can't be done. Because if you get more drugs, more procedures, more surgeries that are more complicated to make you live longer and longer and longer, there is no mathematical way to lower the cost of health care. That's impossible.
And if
health care costs more because people are living in their 90s now instead of their 70s. So unless you have the good grace to check out early, the health care is obviously going to cost a lot more money.
This is a nightmare for anybody listening that is able to make a livable salary and has health care that they like right now, health insurance. A nightmare because you're going to be pulled down towards the middle. They're going to regress you to the mean. That's exactly what they're going to do, which means, as John said, you end up in the pot with everyone else, which is 12 million and growing Californians who don't have any other on Medi-Cal.
What is the point of working and succeeding, and then in the end, they take away your health insurance and give you the same coverage that anybody who stormed over the border yesterday will get? This is what's infuriating.
The argument they make is that by taking health insurance companies out of here, they take away the profit, which is going to lower the costs.
I don't believe them.
You'll just have the doctor in the service and not any markups.
The Obamacare thing was supposed to do that, and the premiums for Obamacare are shooting through the roof. In some places, it's going up triple digits. They were wrong. They're always wrong.
They complain that's not single payer.
It will never go down. It will never go down because nobody wants to accept fewer years on the planet. Nobody wants to accept not getting the fancy surgery, not getting the MRI, not getting the miracle prescription drugs.
So how does this work?
No one's going to ever accept less of that.
Everybody's been frustrated because insurance companies, you often get the bill in the mail and they're not paying for this, not paying for that. Is the state going to pay for everything? You're not going to get denied some of the I don't know how that's going to work. And if they're not going to deny, how much is that going to cost?
You can't do this without rationing health care, which is what happens in these socialized medicine countries. You can't get the surgery when you want. You can't get the appointment when you want.
You gotta wait.
You have to sit and you have to wait and wait and wait, and there's limits. Oh, this is a disaster. Only crazy people want this.
Right. Well,
only crazy people.
This works better for really poor people. It does, but it does not work well with people who are making it in life.
Oh, it'll crush the middle class. Like they haven't been crushed enough in this state.
Well, you want to talk about this? We're at 1-800-520-1534.
God, sick of these pie-in-the-sky dreamers, you know? They all have their fantasies on how the world should work. John and Ken Show, KFI. Deborah Marquez News.